Very good to have you with us, Charity McCormick. How bad is it here in South Africa? Remind us, because we know it's not what it should be.
Yeah, thank you very much for having me, Jane. I think in South Africa, the statistics as they stand is 17 million. That's about 1/3 of our population. That's quite a staggering amount. And of that 17 million, less than 30% of the people get treatment for these disorders. So about 75% of people actually get treated for these mental health issues.
And I quoted the age of 14, that, you know, this is an important time to identify it, or it sort of comes out at that stage. But surely it's a lot earlier than that, that children should be picked up on this, considering what happens in this country, the gender-based violence, for example.
Certainly. I think also the conditions in which a lot of our children are born into, and some of the like you mentioned, the violence, the socioeconomic status of the country, makes it worse for children and people who are already genetically predisposed to some of these mental health issues. And what happens is that it's not picked up and not treated accordingly, that a lot of people wait for things to be at a crisis stage. So by the time people present to a mental health practitioner, it's already in dire straits. And I mean, it's quite advanced at that stage, and it's dangerously high that people are able to receive the adequate treatment. And I think it's quite heartbreaking, because a lot of these conditions are treatable, and there are known treatments that are proven to work, but a lot of people do not have access or do not even know about some of these illnesses, or how to pick them up, or how to see.
And when is it too late for treatment? Is it ever too late for treatment?
It's never too late. I mean, it's hard to say, but it is never too late for treatment, because a lot of the treatment is quite effective, but it is very costly. And I think particularly if someone does not have access to private health care, it becomes very difficult because of the long waiting list, that the demand far outweighs the supply of mental health services, particularly in the public service. So it becomes very difficult when someone is very desperate for help and there aren't beds, for example, in a psychiatric institution, or they aren't able to receive the help just because of the sheer numbers and the waiting list.
And you say that there are 17 million people. I mean, how do we improve identifying people, and how do we get them into some sort of program?
I think the first step, and I think this is the easiest one, is to be able to see mental health issues as an illness, and be able to talk about them, and the way in which we use the languaging around it, to see it as something that is an illness, because in that way, when we reframe it and we rephrase it, people see it as something that warrants treatment and that they can receive treatment for. So I think that's the first step, that people are educated and they know how to identify it. That if someone is struggling with depression, for instance, it's not something that they can just snap out of. Like any other physiological or physical illness, mental health issues are the same. They are diseases, they're illnesses that can be treated. And I think it's in starting in that, in conscientizing people, making them aware that these are struggles and illnesses that can be treated. That's the first port of call. And I think they to capacitate, and I think this is a bigger issue and something that has been ongoing, capacitating health services, particularly public health services in the country, is something that is absolutely pivotal.
Okay, Charity McCormick, thank you very much for talking to us.